Tell us a little bit about how you balance your COVID era duties with your other full-time jobs.
Well, it has not been easy. And what has happened, and I don't want anybody to feel sorry for me about this, but I have not had a day off since the middle of January of 2020. And that includes every Saturday and every Sunday. And, the days are 5 a.m. when I get up until midnight when I go to bed. And if you put that amount of time in, you can actually do both. I've made a very I've made a very, very important commitment that I would not neglect my job as director of NIAID with all of the other responsibilities we have to HIV, to malaria, tuberculosis, other types of not only infectious, but inflammatory and immune-mediated diseases. At the same time, that out of necessity, not only I, but so many of my colleagues have had to pay so much attention to the response to COVID-19. And I think as scientists, all of us in the scientific community should really feel good about, if there was one resounding success in all of this, it has been at the level of the science. And it isn't only what we've done here at NIH and Bethesda, but the countless number of grantees and contractors whose fundamental basic science led to the kinds of things that we were able to do so quickly. So I think that this is really an important accomplishment of the entire scientific community. Back when I was an intern, assistant resident, and chief resident, it was at a time when you were on every other night and every other weekend, which there were some good things about that and some bad things about that. But you really learned back then how to suck it up. You have 3 patients who are sick as can be, and the ER calls you up and says, by the way, I have a bleeder coming up, or I have somebody who just had an acute myocardial infarction and arrested in the ER is coming up. You don't say to yourself, excuse me, I'm too busy. You say, okay, bring them up. So it's the same thing now. When you're dealing with a crisis like this, just make out you're an intern again and do it.